In this series, we're going to take a look at how the state of Iowa responded to the COVID-19 pandemic. The last year has challenged all of us to adapt to our circumstances, and all over the United States, COVID-19 was handled differently. In Iowa, the first months of 2020, local news constantly reminded Iowans of the upcoming caucus, while buzz of the new coronavirus originating in China was slim. But that changed just 5 weeks after caucus night, when our state would have its first confirmed cases of COVID-19. Governor Kim Reynolds announced on March 8th that 3 people who returned from an Egyptian cruise had tested positive for the coronavirus, and she signed a proclamation of disaster emergency the next day. However, with the announcement of the first confirmed cases, the governor also said that, quote, no additional or special precautions are recommended for Iowans beyond the simple daily precautions to combat the flu, including washing hands frequently, covering coughs and sneezes, and staying home when ill. These announcements came a few days after Congress approved an $8.3 billion emergency spending bill to help public health agencies respond to the coronavirus. On March 11th, the World Health Organization classified COVID-19 as a pandemic, prompting many states to begin taking more serious precautions to reduce the spread of the virus. Iowa followed suit. Reynolds recommended that schools close for 1 month, and on March 16th, the Iowa Department of Public Health set up 2 tents outside the Capitol building in Des Moines to provide medical screenings to everyone who entered. The state hygienic lab also opened a second shift that allowed for 108 COVID-19 tests per day. The next day, Governor Reynolds signed Senate File 2408 into law, which, among other things, allocated additional funds to Medicaid, health programs, and the state hygienic laboratories. Following the implications of this law was the federal proposal of the Families First Coronavirus Response Act, which Senators Joni Ernst and Chuck Grassley voted in favor of alongside 90 other senators. However, they also voted in favor of an amendment that would remove paid sick leave from the act. On March 19th, Governor Reynolds announced in a press conference that the state hygienic lab can now test 800 people, but the announcement came with a few exceptions. The state's lab could administer more tests, but only for people who met a certain criteria. This criteria excluded a wide range of potentially at-risk individuals, seeming only to apply to those who have been hospitalized with potential COVID-19 symptoms or traveled to countries with travel warnings. While hospitals were not required to receive state approval to administer tests, the state lab reserved the right to refuse to run the test if they felt that the individual failed to meet the criteria. Iowa began to grow quiet as the month came to an end. Reynolds issued an initial order closing gyms, dine-in restaurants, and bars and limiting social gatherings to 10 people or fewer. Further orders halted non-essential medical procedures and closed other businesses, including theaters, spas, and hair salons. Child care centers remained open so parents in essential fields like healthcare and food production could go to work. Schools were closed and universities extended spring break or moved to short-term online learning in hopes that COVID-19 would be a temporary problem. The closing of businesses forced many Iowans out of jobs, many wondering when or if they would see another paycheck. The Iowa Workforce Development experienced a drastic increase in unemployment claims, comparing the numbers of claims they were receiving daily to what they would get in a span of a busy month. March 24th marked the loss of the first Iowan to COVID-19, as well as 145 cases of the coronavirus. The case count broke only 20 cases just 10 days earlier. Despite the growing case numbers, Iowa did not issue a shelter-in-place order like 15 other states had. The state health department's deputy public health director told Iowans at a press conference that, quote, it's important to understand that the sheltering in place for 2 or 3 weeks will not cause the coronavirus to go away. Quote, in an attempt to ease some of the financial burdens created by the pandemic, the U.S. Senate passed Phase 3 of their coronavirus response bill on a 96-0 vote on March 26. The $2 trillion bill provided a one-time stimulus payment to American adults and their children, as well as small business loans, aid for state and local governments, and an expansion of unemployment insurance. The day after this bill was passed, the Iowa Workforce Development announced that 41,890 Iowans had filed for unemployment. In response to citizens and representatives calling for Reynolds to issue a shelter-at-home order, the governor issued a statement in a press conference that, quote, she believes that Iowans don't need an order to do the right thing. Quote, at a press conference on March 29th, the deputy director of the Iowa Department of Public Health projected that Iowa would reach its peak in cases in 2 or 3 weeks, before emphasizing the numbers were always changing. In response to this potential peak, Reynolds announced the next day that the state would be getting at least 15 mobile testing units in the coming week that would deliver tests within minutes. By the end of this unsettling month, 4 Iowans had died of COVID-19, and Iowa's case count had increased to more than 300 cases. From March 22nd to March 28th, the Iowa Workforce Development reported that 55,963 Iowans had filed for unemployment, the largest one-week spike in state history.